couple of the goals for today. We want to create a safe space for candid discussion and learning, connect as a community, and share resources and perspectives with each other. So with that said, I'll go ahead and introduce myself. I'll be the host of today's webinar. My name is Steve Smith. I founded Experiential Consulting in 2008. We are a team here of risk management consultants based out of Seattle, Washington. And I personally have been working in the outdoor industry for 30 years. I have a background at Outward Bound and Student Conservation Association and other organizations. I had the honor of chairing the Wilderness Risk Management Conference. And I currently serve as a member of various safety committees and accreditation councils. I'm a regular speaker at national conferences, and I actually have a background in teaching at Washington State University and a background in human resources. So the point is, all of these different experiences give me a different set of lenses to look at this risk management work that I do. And that's me. I'm going to turn it over to our first panelist to introduce herself.
Hi, everybody. Thank you so much for joining us globally. My name is Elikem Tomety Archer, and I'm the VP of Programs at Global Citizen Year. And for those of you who don't know who we are, Global Citizen Year is a leadership development program. And I'll tell you a little bit more about our work when I get into what we were facing. And in my role, I oversee the work that we do in 4 countries globally. So that is, and the team that is also based in the 5 countries in which we work.
Thank you, Elikem.
Yes.
And Tim.
Yeah, thanks, Steve. Thanks, Elikem. My name is Tim Hare. I'm the Director of Risk Management and Staff Training with Where There Be Dragons. We run international experiential education programs, gap year, summer abroad, school partnerships, teacher trainings. And we're in kind of a unique place where we just evacuated all of our semester and gap year programs. We're in a bit of a lull before the summer season, but yeah, I think the biggest kind of piece of information that's relevant is we just managed this past Saturday to get our last students and instructors out of Peru, where they were under quarantine for 10 days after the country shut its borders. So we're breathing a little bit easier now in the last couple of days, which is great.
Great, thanks, Tim. And last but not least, Anne.
Hi, thanks to everyone for joining us today, and thanks to Steve for organizing this call and conversation. I'm Anne. I'm the Executive Director of Enrollment and Operations at Carpe Diem. Similar to Dragons, we run semester and year-long international gap year programs. We also just finished evacuating our last students last Tuesday, so we're having an opportunity to kind of look up and look ahead right now. In addition to enrollment and operations, I also oversee our marketing, and I'm a member of our risk management team.
Fantastic. Well, I feel very fortunate to be able to bring these folks together, especially so quickly on the heels of managing a lot of situations all over the world. And it's illustrative to me of the last few weeks of my life, which has really been spent working with programs and on video calls like this and webinars with programs all over the world. And I've been so impressed by some of the remarkable challenges that I've seen organizations encounter and thoughtfully address. And I wanted to bring these 3 folks together, especially because I'm aware of some remarkable challenges that they have also encountered and some great work that they've done in responding to those, and wanted to create a space here where we could really, as Anne just said, not just be running in the hamster wheel right now with coronavirus, but actually pausing for a moment, creating some learning space, sharing some very live and fresh perspectives, and some candid insights, about what we're learning and how that's going. On a personal note, I have a brother who is a fireman in New Orleans, and that's been a very difficult situation to watch from afar. And I certainly hope that all of you are happy and healthy and, you know, doing okay in an okay space while we are here today to create some learning around this issue. So with that said, I will give a preview of our agenda for the day. Topics that we're going to go through with the panelists. We're going to do one question at a time and then cycle through the speakers. I want to start by asking, how has COVID-19 presented specific challenges for your program? How have you assessed and managed those risks? What has been the hardest part? And what are some things that we can all take away and learn from that? If you have any considerations, you know, not necessarily advice, but thoughts that you'd like to share with other programs, that would be great. And then we'll have a facilitated discussion and questions from folks, the participants here. You can submit your questions in the chat box. So then we will wrap up. We are not, this is as a reminder, we are not providing any specific legal or medical advice to you. We're not doctors or lawyers, but we can share with you the thoughtful decisions that these folks and their organizations have made. So let's do a quick poll before we get started. You should see, do you see a poll on your screen there, folks? I want to get a quick pulse from the participants as to what kinds of organizations are represented here on the call. So we're trying to figure out what kind of organizations are represented and some of the biggest challenges that you've had so far in managing COVID-19.
Looks like there's some folks in the chat room saying they don't see a poll.
Okay. I see. Looks like a few people are voting. Still no poll?
I see it now.
Okay. So we'll give you just a moment. Hopefully the poll is up there, folks. Oh, someone is suggesting to exit full screen mode to see the poll. Looks like a lot of people are voting now. Thank you. Okay, go ahead and wrap up your voting. I'm going to go ahead and end the poll and share the results. Can folks see the results? A lot of the 55% of the people that voted were from outdoor education, but we also have representation from gap years, study abroad, conservation corps, schools, colleges, camps, wilderness therapy or therapeutic programs, some private practice like attorneys, and ecotourism represented. And by far, it seems like the biggest challenge that the participants voted was adjusting operations to match the situation. And I see some nodding heads there. We can, I'm sure as our stories here will unfold, we can really share in that challenge because of how rapidly the COVID-19 situation has not only onset, but how much we continue to learn each day. So I think that's not a surprise to me to see that that's been a real challenge. Followed by all of the above was another not surprising answer there. Great. So we're going to stop sharing the poll and we're going to carry on. And if the panelists are ready, what I would like to do is go on into the first real question for the group. And we're not going to go into the solutions and how we solved these specific challenges. We just want to get a list from the 3 different organizations, some of the specific challenges that they've encountered. Elikem, if you don't mind kicking us off, that'd be great.
Thank you, Steve, and thanks again for everyone who is joining us. And so just to give you a context, Global Citizen Year is based in California, and every year we recruit a talented kids of high school graduates from the US and also across the globe. And our program is about the equivalent of an academic year, and we place them in 4 program countries. And so they are in Ecuador, India, Senegal, and Brazil. So that context is important as we think about what we were facing this, I will say, February, March time period was really when we started to hone in on COVID. So our class of 2021 was in full program cycle when COVID broke out. So what we were facing was a cohort of 150 fellows from over 30 countries and as many states in the 4 program countries. We also have year-round staff in each of our 4 countries. So we have a team of about 50, and most of those 34 of them are placed in our program countries. So I guess for us, there were a number of questions that we were facing. The first question was whether or not we will be running our reentry training. So reentry training was scheduled to happen the 2nd full week of April. So they were arriving in the US in California on April 5th, and they would be here in the Santa Cruz Mountains for a week. So the second question we were facing this. So first question was, do we bring our fellows to reentry training? About 150 people coming from 4 different countries, representing about 30 countries in the 30 states, over 30 states, coming to California. That was question number 1. Question number 2 was, will we continue running in-country programming? Because this reentry training was scheduled for April, but the program was extending to April 4th in the 4 countries. So that was question 2. And then question 3 was, what if any impacts did it have on the class of 2021? So the next cycle that will start this fall and go through next year. So I'll pause here for now because Steve said we should only do the questions that we were facing. So this were the broadly things that we were facing at the beginning of dealing with COVID.
Thanks, Elikem. Let's go to Tim next, please.
Yeah, so we had very similar challenges. Our programs, this spring at least, were in Senegal, Bolivia, Peru, Guatemala, China, India, Nepal, and Indonesia. So we were tuned in quite early, in the beginning of January to the COVID outbreak in China. And I think I've been trying, I sometimes like coming up with like metaphors, and I'm like, if COVID were a metaphor, what would it be? And it's like something that comes on slowly and then all at once. And we were able to at least see like this slow arrival of it from our time in China. And in mid-January, we it became untenable to run programming in China. We were in Koenning, so we were far from the epicenter, but travel restrictions were picking up. So a lot of the early challenges were the challenges that are facing programs even in the US or anywhere in the world at this point. And that's lack of, travel options interdepartmentally or even around town, suspicion of outsiders. So like traveling to new communities became, untenable, a strain on medical infrastructure. And then also like increasingly evacuation to like third countries became a bit more challenging because people weren't letting folks in from China, for example. So we evacuated that group to Taiwan, and we kind of settled and we breathed a little bit easy for a month. We were like, okay, our group's in Taiwan, and then since then all the other countries, again, it kind of came slowly and then all at once. And so the challenges really for us became largely around those peripheral risks, much more than the specific risks posed by COVID to our participants or our staff or communities. There's the risks of transportation disruptions, strain on medical resources, visa restrictions, lack of international flights, things like that. Fortunately, as we were going along, we were able to develop like an in-field management plan that helped. So initially we're like, okay, we've decided we can still run programs in a lot of places, but we need to manage the risks posed to our groups, evaluate our own risk threshold for this disease, at what point we'll cancel or evacuate. And so we're able to develop those as we went along. But then ultimately, I think an interesting thing was like, it didn't really matter what we did. Most of the most consequential decisions were totally out of our hands. So it kind of took away our agency when big forces, government forces, public health notices started to drive the conversation, that we just were in a much more reactionary position of just trying to predict, but then really responding to all of the new strategies that have been implemented in each country. And I think that's something that now exists across the entire planet. So whether we're in the US or anywhere, we're really just doing our best to consider the viability of programming within this kind of new landscape that we're in.
Thanks so much, Tim. That's great. And they covered a lot there, but I'm sure there's some overlap. I'm curious if you have anything different to add than what has already been said, or how did it go for Carpe Diem?
Sure, yeah. So for some context, this spring we had 5 group semester programs in the field, which started in mid-February. And then we also had 28 students completing independent volunteer placements around the world in regions from South Africa to Spain and beyond. So that added an extra layer of complication for our response as well. I kind of thought of the challenges we faced in a bit of a tiered approach as I was reflecting on this over the past couple of days. The first challenge that we faced was how we were going to educate our field staff, our students, and their parents about the risks and challenges we were experiencing with the coronavirus. That was particularly difficult because our staff training was happening in early February, which is when information was coming out pretty quickly about the coronavirus and symptoms and how to keep students safe and how to lower risks. So that information was changing pretty rapidly, which added another layer of complexity to our communication. A big challenge that we faced during the first couple of days of our India semester is that one of our students was actually quarantined upon arrival in India. This was the first day of the India semester. The student was quarantined because she had a 99-degree fever, which isn't much of a fever, but it counted at the time. So she was hospitalized and isolated for 3 days on her own, which presented a huge challenge for our staff here in Oregon, as well as the 2 field staff who were on the ground supporting her. Ultimately, that student ended up leaving the program early just because it was such a traumatic and challenging experience for her. And then making the decision to end our programs early also presented a number of challenges. One of the big challenges was trying to determine if our students and leaders were potentially better off staying where they were in the field versus being exposed to all of the additional risks of coming back and traveling and kind of all of the media frenzy that was happening here in the US that potentially they weren't exposed to or experiencing where they were. Another challenge was that families were reporting that they would have preferred that their students would have stayed where they were. That's something that we considered and listened to those families and had those conversations, but it was just an added layer of challenge as we were making these difficult decisions. And then another challenge was just navigating relationships with our partners in country who are hosting our groups. Some partners were deciding to cancel their work with us for later on in the semester. Others were completely closed. Others were comfortable with our groups still coming, and that was kind of all across the spectrum for that. And then another challenge we're looking at, just looking ahead, is we have fall programs that are scheduled to leave in September. So figuring out how to adapt and plan and be cautiously optimistic looking forward.
Well, that's quite a list of challenges that your organization's faced. And I've been working with some of you as well as other organizations, and I've got my own list here of some of the things that we've seen. And it certainly includes the rapid changes that are going on in information and what we understand about the virus itself. Communications around the world, internal communications with your staff, a few of you mentioned, as well as external communications with the families or partners. And kind of alluded to this one, people with different risk tolerances or different ideas about how they might approach this situation as a family or as an individual, as opposed to the decisions that you all are making as organizations. And what's the gap between your organizational tolerance for risk versus all of those different individuals, families, participants, staff, pieces like that. So that gap can create friction in moments like this. Travel restrictions and other externally imposed things, like all of you mentioned, some of which can happen quite abruptly or start and then be drawn back again and then come back in a different way. So that's been a real challenge. Some fear and disappointment by folks if the program's ending early or not ending. Either one can create fear and disappointment. The financial impacts are obvious. As well as many of us who have not only been managing these complexities, but doing it from a new workplace. You're no longer necessarily at work with all of your colleagues and living in this virtual world that we've been in. Someone described it to me yesterday as zooming around all over the place on Zoom calls. And just uncertainty, I think, is probably the biggest piece that I've seen organizations trying to have clarity and to make confident and certain decisions in a larger backdrop of uncertainty, which is, I think, kind of summarizes for me much of what these last few weeks have been like. So thank you for sharing those challenges. We're going to move on into the next piece, which is, and feel free to take your time and unpack this one, or even bounce back and forth between the panelists. But maybe we'll start with Elikem again. What were some of the tools and strategies and approaches that Global Citizen Year took to assess all that long list of risks, and what were some of the strategies that you've been using?
Thanks, Tim. Right, yeah, I think all of us listed a myriad of challenges and at different times through and we're still living it, right? At different times through the period, the last couple of weeks, we were facing different types of those challenges. But when I think about how do we assess and manage the risk, I think maybe the biggest learning for us there was first deciding what the framework with which we were going to make decisions. And this, I will say kudos to Steve, who sort of helped us sort of think about, start with what is your philosophy and what is your framework through which you're going to make the decision. And I think that was helpful guidance for us at the beginning. So we really, as a leadership team, came together and decided that we wanted to make decisions based on facts, which seems like a no-brainer, but was important, as Steve mentioned, and I think the rest of the panelists talked about the different risk tolerances that our stakeholders had. And so we really said our framework was we wanted to make decisions based on facts. We wanted to be empathetic. We wanted to be use an equity lens, and also make sure that the decisions that we made were values and mission aligned. So for us, that was sort of the philosophy and the framework with which we we made decisions, and I'll give examples of how that sort of played out as we were going through. Then we said facts. We were focusing on information from the US State Department, CDC, and WHO. So that was really where we were getting most of our, pretty much the factual information from. We also reached out to a number of external experts to help us, but that was where we would, we sort of put in our emergency response protocol, which meant that we put together a COVID-19 task force internally. And every day we would meet for about a month running. I think somewhere from beginning of February, we actually had the last meeting today and decided that we were going to table the daily meetings for a little while, as we thought, before we thought about the fall. So we did that ERP, put together a task force, and then we had a framework with which we were making the decisions. So the first thing was fact-based, mission and values aligned, empathetic, and with an equity lens. The second thing we said was also we wanted to look at local context, because we ran programs in 4 countries. And so in 4 countries and different areas in the country. So whilst the global numbers for COVID-19 may be alarming or would be really different from one country or from one area to the next, for us, it was important because of the way we ran our program to not just look at the global numbers or even sometimes the country-specific numbers, but also go deeper and look at what is the local context. The third criteria was, how does the program, how do the changes affect our ability to responsibly run a program, and how does it impact our fellow experience? So I think Tim mentioned this about restrictions in country and travel. Our program is a global immersive program. They're living with host families and they're going for apprenticeships. They're working about 20 hours a week at the minimum, often more than that. And they're also living with host families. So once restrictions become prohibitive for us to be able to move around, then we can't really run a program and the fellow experience will be impacted. So I think those were like the big umbrellas under which we were running, we were making our assessments. And so then we had a number of decisions. We said, what is the first decision? The first decision was, will we be able to responsibly run the reentry training, which was a training of bringing the whole cohort to California. And we decided that was the first decision that needed to be made. So I think first the framework, how you think about it, and then what are the key decisions to be made, and what is the sequencing, if you will, of those decisions, because initially it could be overwhelming to think. For us, we had all these, will we run programming, will we bring them home, what about the fall, what are we doing? And we decided that the first decision was reentry training. Could we do reentry training? Then the second decision was, could we continue country programming? And then the third decision was, what about the class of 2021? So the cohort that will be starting this fall. In the last few weeks, we've made decisions about 1 and 2, and we have decided to wait on decision number 3. And so in the midst of it in February, we really decided that we had to answer the first question, which was, could we do reentry training? And when we looked at all those 3 criteria and framework that we had set for us, that was the first decision we made, was to cancel reentry training in the way that we would do it, which was bringing everybody together, and move it to a virtual reentry training. Initially, the decision actually had been to cancel reentry training and do it in country, in the 4 countries. As the information changed swiftly over the week or 2, we ended up canceling in-country programming, ending in-country programming, really when the WHO declared it a global pandemic, and in the same day the US restricted travel to Europe. That week was when we actually decided to end in-country programming and get our fellows out. And so then we moved re-entry training to a virtual training, and which is actually happening literally as we speak right now. This week, we are doing reentry training virtually. So I'm going to pause there. I'm sure we will have more discussion, and I'll let my other panelists sort of chime in now.
Thanks, Elikem. Let's keep our batting order here, and we'll go to Tim.
Yeah, thanks. I really appreciated the kind of eloquent structure of the way you approached it at Global Citizen Year there, and the layering of it. I think for us, this question's interesting. I've never really, I don't think any of us have seen a problem quite like COVID that kind of plays with the, the risk management matrix and perceived versus actual risk and risk tolerance and all of these things that we speak about so frequently in the risk management world. And it's a very hard one to assess, but I think some of the, it's a different landscape now, but at least initially, it seemed like a fairly straightforward process for assessing and managing the risk. It was gathering information related to the probability of exposure, identifying that, based on, health history and things like that, the risk to young adult travelers, which are the majority of ours, as well as young, healthy adult, staff, was low, especially considering the numbers were so low. That we were largely managing a lot of the peripheral risks, which became, through the entire process of supporting our GAP programs in the outbreak as it worsened. That was really our lens. Our kind of canned response was, we deem the risk of contracting COVID to be low for our participants and the risk of complications to be, lower still. And so we feel comfortable continuing to operate in this environment. And that was the case in, Bhutan, Nepal, Taiwan, Indonesia. And really in the last 3 weeks, a lot of that has changed, and the calculations just, very different. So, we are looking a lot more at how to, minimize the exposure to communities that we're working with. And that started to become kind of present. That was honestly one of the bigger decision-making points for us was, we were going into a community in Indonesia. The numbers in Indonesia, the official numbers were, I think they had 13 cases at that time. But the community asked for our group to receive a clean bill of health from a local clinic before we could come in. And then when we went to do that, the local mayor actually said, sorry, we're not going to allow outsiders in at this point. And this was before, maybe a week before things really picked up across the globe. So, I think the calculation changed very quickly from just trying to kind of separate the actual versus perceived risk of contracting COVID and having complications from it, versus just looking at the entire landscape that we're operating in. And the bigger risks that we're assessing and trying to manage now are related to public health, ethics, and just the availability of transportation, or whether homestays are feasible with, the quarantine measures that are in place, or whether a group of 15 is even allowed in, which is our group numbers with 12 students and 3 instructors, if it's even allowed in that country, and at what point it will be. So we're looking at an entirely different landscape now, but at least initially, that was kind of a much simpler calculation.
Great overview, Tim. Thanks so much. And it's really notable. I think I really appreciated how you pointed out things that were kind of obvious to us at the beginnings of these decisions changed a little bit as we learned more about COVID-19 and who's actually, who is at risk from that. And then expanding the circle to think about, not just our participants or our organizations, but the impact we can have on those communities, or, here in the United States, the gateway communities that are entryways to national parks and things like that. So really just appreciate that great overview you provided. Mm-hmm. And what would you add to this discussion as far as some of the strategies and assessments and risk management decisions for Carpe Diem?
Sure, yeah. I think I'll speak more specifically to the strategies and kind of tools we had in place to assess and manage risks. One thing that became clear to our team after a few weeks of managing the situation is that we had to be ready to move and change things pretty quickly. And fortunately, because we do have pretty small group sizes and we do have staff on the ground with our students, we were able to be nimble and make adjustments as we needed to. So that, I think, worked to our advantage. As Elikem mentioned, we were monitoring similar sources such as the CDC, the WHO, the State Department, and the Overseas Advisory Council, which sends daily or twice a day updates on situations in specific countries where we had students. Additionally, we were having very frequent check-ins with our overseas educators who are our leaders, who are on the ground with our students, kind of talking to them about how their students were doing, checking in to see if they had any additional information that maybe wasn't coming to light through the news or other media reports that we were seeing. And we were looking at this situation differently for each group depending on their location. For example, we had a group in New Zealand. We were approaching that pretty differently than we were for students who were doing an independent placement in Spain, for example. And then, as I mentioned earlier, before our groups went into the field, we trained our field staff on how to lower risks for exposure to coronavirus and how to monitor students for symptoms that they could be experiencing with this. And our leaders also facilitated a kind of coronavirus awareness session in their group orientation in the first few days of their semesters, which I think is important and something we'll definitely include for the future. After our student was quarantined in India during the first couple of days of the program, we actually created a quarantine policy so that all students and leaders would know what to do if that happened to another student during the semester or when they were traveling back to the US when they were evacuating. Another layer of risk management that we put into place, and I think this really helped with communication, is that we were proactively communicating with all of our students and parents prior to the semester and then multiple times during the semester about new information that was coming to light about COVID-19 and our response and how we were managing those risks. I think having those open lines of communication made a big difference in how parents responded to the situation and the tricky decisions that we were having to make. And then one other thing we had to consider is kind of how this pandemic was impacting our ability to utilize our existing risk management policies and practices that we have in place for all of our programs. So questions we were asking is, would we be able to get to a group or to a student if there was a need for an evacuation or if we needed to bring in staff for additional support? Would students be able to be evacuated for other medical reasons if that became an urgent need? As countries like India and Guatemala were closing their borders and canceling existing visas, that became nearly impossible for us. And that was kind of a line that we had to draw with our comfort level and our risk tolerance. And then we've also had we were having a number of conversations with our flight consolidator. She's someone who books all of our international travel for our students. And she had additional information from airports and airlines about how much they were reducing flight capacity and restrictions that were coming into place. That allowed us to make decisions in advance of those airports being closed or of flights being canceled, which allowed us to get students out of the locations where they were. And something else that's been really helpful with our risk management is having conversations like this with other leaders in the field about how they've been responding to the challenges they're experiencing, what they're seeing on the ground, and how they're moving forward. So that's been really helpful for our team, and I know other folks as well.
Great overview. Thank you so much.
Mm-hmm.
There have been some really wonderful gatherings like this put together by, the Gap Year Association hosted one, AOR, AE, different organizations have been putting together opportunities to share insights like this. So it's great that we can do it here as well. There was a specific question for Elikem that came in that I would like to read, and it was making a distinction between the reentry training and the separate decision about whether programming could continue. So the question says, why was the reentry training prioritized over whether programming could continue, and was that based off of immediate risk to the participants or to the organization? So Elikem,
yes.
what's your thought on that?
Good question. It was due to the immediate risk that we had assessed to our program participants in the program country. So I think Tim mentioned this also. In the initial stages of COVID-19, our participants are also young adults. And so if you look at the risk factors for COVID-19, they are mostly healthy. The chance of them actually contracting the COVID-19 at the beginning of this season of COVID-19 pandemic, I don't know what to call it. At the beginning, the risk to them in the countries that they were in and in the community was very low. When we were looking at this in February, in the Bay Area where we were situated, the numbers had, and I think by the time we made the decision to cancel reentry training, San Francisco had already declared a state of emergency in San Francisco. And so, and as some of you who are in the United States would know, this Bay Area was also the first in the country to go on a shelter-in-place mandate. And so given where they were in the 4 countries, the case numbers at a country level in those 4 countries and at a community level, the immediate risk seemed to be more about them coming here. So it was location of reentry training. The second part of it is that looking at what we knew about COVID-19, the idea of moving about 150 people traveling and landing in a place and keeping them together for a week after they had gone through international travel with symptoms. Often they arrive in the spring with colds and whatever. They travel usually more than 24 hours to get here. And the question was, could we say that we could responsibly run re-entry training with no risk to our fellows? And so when we felt like the risk was next to zero, but it wasn't zero. And because of that, we felt like that was the immediate question we had to answer. So that's why it was more of a priority in sequencing than a priority in the importance of the decision. I hope that's clear.
Great, thanks so much. Anything else to add from Tim or Anne on any of these questions? Oh, Jason just wrote and said, thanks so much for your insightful answer, Elikem. One piece that I've seen, not just in your stories, but in other organizations kind of grappling with, maybe I'd love it if the panelists could explore this question. You know, there is a school of thought that the participants are better off staying right where they are. And that maybe the participants or even some of the staff or the families might prefer, you know, I live in New York City, you know, or I live in Los Angeles, I live in a hotspot, and I think my son or daughter is better off staying right where they are than coming home. And, you know, that is certainly a valid perspective, but I also think that there's complications. It's easy, sometimes it's easy for the families to say that and difficult for the organizations to absorb that. So I wonder if your organizations encountered that specific thing in any way, and what your thinking was around how to address that question. So I'll just open that one up to anyone that would like to address it.
Yeah, I would say overwhelmingly, we were hearing from families that they wanted their students to stay where they were. Students were having really powerful, impactful experiences in the field, and they were mostly sheltered from everything that was happening here in the US and elsewhere in the world. They weren't really seeing or feeling the impacts of this pandemic where they were at that time. We also had families who maybe had someone in their family that's high risk or immunocompromised, and they didn't want their student traveling and coming back to their house and potentially exposing their family or adding that layer of risk when they could avoid it. Again, when our typical risk management policies and practices were compromised and no longer able to be upheld, that's when we had to make the decision that we no longer felt comfortable with students in the field. Additionally, our leaders in India, they were waiting in line at an ATM to get money, and they were harassed. And that was kind of a final line for them. They decided that they were no longer comfortable being responsible for a group of students and being in the field and having that presence in the community that was clearly controversial or maybe not wanted at that time. So it was difficult to balance that emotional element of what we're hearing from the parents and the students, and also maintain a high level of risk management on our end.
Yeah, I think we had, in general, there was a really strong refrain from parents that they wanted them to stay on course. There was about a 4-day window where we had decided to keep our programs in the field, to then 4 days later deciding to cancel. So we were evaluating it every day, and in that window, a lot changed. specifically the State Department putting out the level 4 health advisory for the entire globe, and countries starting to implement more significant restrictions like Nepal, India, and so we could see the writing on the wall at that point. And during that transition period, really all parents came on around to the other perspective of wanting their their children to come home. And I think the thought experiment's still relevant though, because it could be the case in 4 months where New York City might still be experiencing the same level of restrictions that they are now in quarantine measures, whereas Bhutan might not be, or other countries might have really low case numbers, and so there's the question of whether programs there are advisable. And really the peripheral risks were what we were looking at when we were deciding to bring students home. So when neighboring countries started restricting travelers coming in, when it was clear that medical infrastructure no longer was able to support even like the most basic medical needs in those countries, when we knew that we couldn't bring in a staff to support a group, like Anne was saying, if they needed extra support, we couldn't get to them because of visa restrictions. When there's this kind of like indefinite time period, like a lot of countries are on quarantine really for, they're maybe setting, like Peru has a date of April 16th right now. I think they might extend it. When you're looking at those sort of indefinite time parameters, that's just, it's unrealistic for us as an organization to be able to support students, participants for an indefinite amount of time. So in the short term, sure, you're moving from like maybe a non-pandemic area to an area that's really hard hit like the US. But in the long term, it's just not something that our programs are really set up to be able to support. It's a huge liability for us to take on as well. So those were all the kind of the bigger calculations. And by the end, all of the parents came around and they understood it. I think at this point, they're all very relieved to have their children home.
A couple of you, oh, go ahead, Anne.
I was going to say our parents have all kind of come around to that as well. It changed really quickly, as Tim mentioned. So we did have those 28 latitude students kind of scattered throughout the world completing independent placements. We encouraged them to come home and let them know we were ending programming and no longer able to support them. But 5 of those 28 students actually decided to stay where they were in the communities where they were being hosted. And those students withdrew from our program and kind of took on their own level of risk and made that decision with their families to stay put.
So a couple of you have mentioned this, and a related question came into the question box. We're not going to answer all the questions. We're going to save most of the questions till the end, but I think this question from Kathleen relates to some of what you're discussing. And she's asking about this moral dilemma, of sending our groups and our programs to isolated communities where, backcountry programs, for example, often start, or smaller villages and things where your programs might be. And I'm curious, like what we've learned a lot about that just over the last few weeks. And so how you were thinking about it at the time might be different than what it is now. But what are your thoughts about, our impact in running our programs on potentially, these gateway communities, and how were those discussions? How would you handle those discussions going forward? Let's ask it that way.
So I can take a stab at this. I'm not sure I completely understand the question, but I'll try, and you can clarify as it goes, Steve. Sure. So for us, I think the community impact is always an important part of what we do. And during I'll call it our emergency response phase to COVID-19, and also even as we think about programming going forward, one of the things we always thought about was the impact on any decision we made to the stakeholders. And for us, our stakeholders were not just our families and our fellows, but were also our program partners. I think both Anne and Tim mentioned that too, as they thought about programs partners. And for us, program partners are our host families, the apprenticeships in which our fellows work in, and the communities in which they live in. And so all through the process, and this changed, right? Because in our case, at the beginning, the negative impacts or the case numbers of COVID in the communities or even in the countries were really low. And actually, with the exception of India, that has spiked up a little bit now, still remain relatively low globally in the countries that we worked in. But it was important for us to think about that impact of the community in seeing foreigners in the country, in their communities now, and with some heightened level of anxiety around foreigners being in the country. It wasn't one of the main criteria that we thought about, but as we talked to our country team, that was part of the decision-making process, really thinking about the community impact and whether or not we could truly represent ourselves as responsible global citizens in what we did. So that was sort of part of the philosophical thing about thinking about, is this aligned with your vision and values? And we are global citizens here. We talk about being good global citizens. And so at some point, we had to think about that in the decision-making framework. So it was a very important part of how we viewed the ultimate decision to either keep continuing programming and or remove our fellows from country then.
Great answer. Anything different to add from anyone else?
I guess I would just say it's an interesting area where, I think similar to what, one of my initial learnings is a lot of the big decisions have been made for us. I think I enjoy kind of debating the ethics of it and the kind of what our public health obligations are and who has, a right to decide these things. Specifically with the domestic program, for example. For international programs, I think as foreigners and, sometimes even with colonial history and things like that, just really do no harm, follow the community's lead as is the only way forward. But especially with looking at domestic programs, and even whether you're, as a rock climber and things like that, I'm thinking about where to go to socially distance and enjoy myself, in a recreation setting. They're rich conversations, and I think the ethics of them are absolutely interesting to debate. From a programming perspective, I've found most of the big decisions have been actually made for us, and that might not be the case in 5 months. There will be more of a space for conversations. But for example, here in Colorado, Estes Park is not allowing short-term rentals. Rocky Mountain National Park's closed. Forest Service land is hard to access because of that. Camping around Moab is no longer legal. So I think in a lot of ways for programs, we're going to be following the lead of local directives. And so it kind of takes the ethical conversation out of it in some ways. That said, I think, if the laws are removed, I think we're learning a lot about it, and we can learn ways to really stay safe and keep groups safe proactively. And we're getting into, potentially some more strategizing. So maybe that's the next question. But I do think there's ways to, ensure that students are safe as they go on to program, ensure that your group culture maintains hygiene and maintains a vigilance with monitoring symptoms, things like that can reduce the risk to the group as well as the host community. And you can have a really open conversation with, the communities that you're passing through about the risks they're willing to accept. And I would imagine that's what we'll have to do in the future, in another 4 months or so, as some of these rules maybe change, and it's a bit more of a gray area.
Great insights. There's a few questions coming into both the chat and the Q&A section, and I want to save those for the end when we're going to do more of a Q&A time. So if okay, and unless you've got anything else you want to add, I think I'll just keep us moving along on our agenda here. So, this section was about risk assessment and risk management, and the stories that these folks have told, remind me of some principles of resilience that come to us, or 4 different modes of resilience that come to us from Dr. Eric Holnagel, who is a brilliant safety author and researcher. And Eric tells us that the 4 modes of resilience are to anticipate, to monitor, to respond, which is a lot of what, if we're just in that reactive mode, if all we're doing is responding, then that can feel like a trap. But it's important to anticipate, to monitor, to respond, and to do what we're doing here today, to create some space for learning. And as we learn, that can set us up to be better able to anticipate and to recognize in the future. So I like this simple model of the 4 modes of resilience, and I just wanted to take a moment and share that with you. It comes from Eric Holnagel, who has written some great books and articles and has a website where you can see more of his work. So just wanted to take a moment and share that with you in the risk assessment and risk management topic that we're all on here. But let's move on to the next phase, which is really a chance for our panelists to share some of the lessons learned that they've had. I have been learning a tremendous amount over the last few months, or weeks really. It feels like months, but it's really just been a few weeks where this has been really closely impacting, my county here, King County, and then the rest of the country, and working with a lot of programs like yours. So I'm curious, the question for the panelists is, looking back over these last few weeks, and it's not to imply that we're out of the forest yet. There's still a lot of work to be done, but just looking back over the last few weeks, what has been the hardest part, and what is a lesson or two that we can take away? So Elikem, if you don't mind starting on that one, that'd be fantastic.
So, thank you, Steve. I think there are a lot of lessons, and like I said, we're still in it and we're still learning, right? And so ask me in a couple of months, I'll probably have a few more to add. But as I was prepping for this discussion, there are a couple that came to mind. One of them is the hardest being how fast the information was changing. And then related to that, I think Tim mentioned this was the perceived and the actual risk. So we were dealing with perceived risk, and perceived and actual risk impacts people's level of risk tolerance. And having such a mirrored amount of stakeholders, there's the fellows themselves in the program, and there's their families. Often the fellow has a different set of threshold for risk than the family that is sitting at home watching the news. And so I think the fastness of the information, the fact that even the experts at the beginning were not quite sure about it, and we're not sure what was going on, how to think about it, how to make decisions. I think that was just really hard, and that affected how we were responding. Like I said, we had a COVID-19 task force. I still remember, I think it was March 4th, was it, or March 13th? I can't remember the day that the WHO declared it's a pandemic. We met in the morning and said, we still believe we were going to continue country programming. That was in the morning. And I believe we sent out a communication that said that. And then at 6 p.m. or so on Pacific time, I was going for a walk, and my sister was on the phone with me, and she said, the U.S. administration just had a travel ban for Europe. And I, in the middle of the walk, I was like, by the time I get home, I expect that we will be having another COVID-19 meeting, and it will impact our Senegal program, because most ways to get out of Senegal to come back to the U.S. was through Europe. The flights our fellows had at the time was scheduled to come through France. And so immediately that was impactful to our Senegal program. And that night we met at like 9 p.m. on the West Coast. And we had an email out by midnight to the family saying we were ending in-country program for Senegal. And by morning, we said we will get back to them about the other 3 countries. And then by morning, after meetings, we had sent to see other countries now start to shut their borders. So for me, the hardest part was how fast the information was moving, but the learning is the importance of communication. And I think Anne also mentioned this, just communicate, and err on the side of over communicating, even if it means even if the message to your stakeholders is it's nothing has changed between that last communication and this one. Just do that. And so we that was the hardest part. That was the learning. I think the subset of that was really understanding, because communication was so important, making sure you took the time to do or we did at least, take the time to do the stakeholder analysis. Who are all our stakeholders and how do we plan on communicating with them? That really helped us to decide who were the ones we wanted to proactively communicate with, what was the cadence of the communication, how often do we want them to hear from us, and who were the ones that we wanted to put information out there to them that they could access, but we were not going to be proactively communicating with. And because we took time to do that, it really helped us focus our energy on our high stake or priority one stakeholders. And for us, those were the people who were immediately impacted by our program decisions. So these were fellows in the programs, their family, and of course our staff. And so that for us were like number one. And that was where we focused our proactive communication and a lot of communication.
If I could add one thing, that's a really excellent insight, Elikem. And the one thing I also remember from that strategy was as you made those different buckets or those different containers of communication recipients, it really helped you when you were writing those messages to have audience awareness, like you were writing for that specific audience, and I think that was a really helpful piece to that strategy that you employed.
Thanks.
So thank you. How about Anne or Tim? What would you like to add to this question?
I can go. There was a couple of really difficult elements that we had to contend with as we were making these plans for next moves and a decision about our programming. Carpe Diem is just a really heart-centered organization, and we're all very invested in the experiences that our students are having that are the work that our leaders are doing and the partners that we work with in the field. So there was a very real human element to wanting our students to have this experience, wanting these programs to continue on, and hoping that things would get better. We had conversations where we considered, like, what if things get better in a week and then we pull the programs today and everyone's home and they're just home and they could be in the field having this amazing experience. So that was kind of a challenging emotional conversation and piece that we had to consider as we were moving forward. Of course, our risk management policies and practices had to be paramount to that, but that was definitely a tricky piece that we grappled with. Another huge challenge that presented for us was coordinating travel back to the US for all of our students, or back to their home countries, wherever that may have been. Fortunately, we were working with a flight coordinator who had booked all of our international travel as group tickets, which allowed us a bit of additional flexibility and gave us the ability to rebook tickets more quickly than we would have been able to if we had to book them all individually. So for example, our group in Guatemala got out of the country just 2 hours before the airport closed. If our flight consolidator had not been able to book that ticket, our group would have been stuck there indefinitely or until additional flights had become available. So she was really instrumental in making this possible. And it also allowed us to pay for the flights directly versus having to bill families. And that made everything a bit smoother and felt more supportive to our clients as well.
Tim, I can see you managing some feline risks there. Tell us.
Pets are happy everyone's home.
Tell us a little bit about, like, the hardest part for Where There Be Dragons and any lessons that came from that.
Yeah, and I see a lot of questions coming in about forward planning and things like that. So I definitely want to leave time for that. I'd say I can keep this part kind of short, if not a bit pithy. The hardest part. Well, it's kind of the definition of a crisis, is that it pushes beyond, what you can reasonably plan for. And I think that's what we're dealing with as a planet. But for us as an organization, it's the only time it's kind of the only scenario actually maybe that I can imagine where we're dealing with the acute crisis of evacuating our groups out of, 8 different countries, as well as the business crisis of potentially, needing to shut down operations because we don't have any revenue coming in. And so those two things together was probably one of the hardest things. beauty in that was actually that we had a lot of people able to support because their other work ended immediately. So, our school partnerships, schools were canceling their travel programs. And so our partnership team was able to come and support, and so we were able to really direct all of our efforts towards supporting bringing students home. But yeah, by definition, none of the things we were doing were, they were all based on, what we had done before, what we had anticipated before, which everything about COVID is such that we need a whole new paradigm for responding to it and managing it. And so the other hard part, as an optimist, as being part of a culture in a small company where we think that we've got it, we think we can respond creatively and that things will get better, and that's the work that we do. None of that has played out in this case. This has been like a perfect time for pessimists, because even the worst case scenarios have like gotten worse. And so I think the good learning there is it's been really hard to be an optimist in this time. And I've had to really check myself and my own decision-making biases based on that lens that I look at things through. So I'm trying to train myself to like actually imagine that it actually could get worse, and it has so far, up to this point. So I think that'll play forward for at least a little while into the future as well.
Excellent. Well, thank you all for sharing those lessons. And this brings us to the questions and discussion phase. And I'm seeing at least 4, maybe 5 questions between the chat and the Q&A box that are essentially different ways of asking this forward-looking question of how are we going to make the decision in the future about reopening, restarting, relaunching programs, and what will be the factors that we adjust or assess or at least think about in making those decisions. So some of you have just like yesterday brought your students out of the field. You might not have had a chance to fully develop this yet. No pressure. But I think it is a very valid question, and it is the question of the day, especially for programs that are summer heavy in the summer months. You've got a really critical decision to make. Some of you have already made critical decisions about either running or delaying or possibly canceling your summer 2020 plans. And I think there's a lot of interest from the chat room about what are some considerations for that. So if any of the panelists have comments to make about looking forward, what are some things that you would suggest that we think about?
I'm happy to present something that I've been working on the last couple of days. I think our MO so far has been, when things open back up, we'll resume programming, ... And it'll look this way. We'll keep delivering our activity components as we always have. We'll go to the countries that we always have. And what I've been working on is actually shifting my paradigm to say, we're actually not running programs. Like Dragons is not capable of running programs right now. And what will change in the world that will allow us to run programs? And so in trying to come up with a bunch of different like switches that need to turn on, social distancing plays into it. Like, can we run programs if students need to be 6 feet apart at all times? Can we run programs if there's no local transportation? And maybe certain programs lend themselves better to it. Maybe you can run outdoor programs where you can maintain social distancing, follow local laws, things like that. But I think we can start with the understanding that like what are the realities right now, and is it even possible to run programs in this environment? We can't expect that things in 2 months or 3 months will just go back to normal. There's a lot of things that probably won't, like group gatherings, social distancing will probably still be in effect. Really minimizing exposure and maintaining good hygiene practices in the group will be a big part of it. So those are things that like I want to see how those things kind of turn on in each country where we operate, and develop a matrix for deciding at what point we can maybe run a program that treks a lot but doesn't do homestays, you know, and that's maybe a bit shorter, and maybe has like a 10-day you know, kind of quarantine period in the beginning of it to set up for that, you know, things like that. I think we're going to have to really, in the near term and through the summer and into the fall, really start thinking creatively about those kinds of things, because it's not going to turn on all at once. It's not like we're going to be able to just go back to our ordinary programming even in September. I think we can look at most forecasts and know that much. So we need to start adapting, you know, right away, to consider the viability of programming.
Yeah, our situation at Carpe Diem is a bit different in that we don't offer summer programs. So we have a bit more of a runway to prepare for our fall semesters, which we've kind of started adapting and adjusting this week, what those are going to look like. One thing I would encourage anyone out there who has a program to think about is just building flexibility into your contracts. Figure out some way that you'll build in some layer of flexibility. So for example, if your program needs to happen in one location, are you able to offer that somewhere else, and will the participants transfer over to that as well? So just something to think about as we're looking forward. We've also expanded our refund policy to give students and families a bit more time to make a decision if they're comfortable traveling in the fall. And then we're also planning on offering later start dates for our fall semesters. Our programs typically start around the second week of September, but we're looking at pushing that back by about a month, and then making our programs 8 weeks instead of the usual 12 weeks as well, which will allow us more time to prepare and also lower the cost for our students and families, which we think is important right now. Our programs typically travel to a couple of different countries in each region. So for example, our program in the South Pacific is in Fiji, Australia, and New Zealand. But in the fall, it will likely only be in New Zealand. The reason for that is we just want to limit the amount of travel we're doing, limit the exposure in airports and the risk of quarantine. And we're also reducing the number of partners that we work with. So we're exposing fewer communities to our student group and travelers as possible.
And I don't actually have a lot more to add to that. Our program doesn't run until the fall, and we are literally in reentry training this week. And so we haven't started to think as much on, as I mentioned at the beginning, that was the decision. We said we had to make the first two decisions and wait on the decision number 3 about the fall programming. But all the things that Anne and Tim have said are things that we have to start to think about once we transition out of closing the class of 2020 to think about the class of 2021. But we do, in our case, have a little bit more time to before we can shift our focus there.
Great question from Malik, asking about strategies to create resilience in your organization around just the stress and the trauma for staff. This has been a mentally taxing, experience, and I'm just curious, what are some of the specific organizational resources and strategies that you've been seeing or using at your program?
Yeah, I'll just mention a couple that we've been using. One, communicating and bringing in our instructors, our field instructors, into conversations really early on was very helpful. So being really honest as an organization about our own fears, our own assessment of COVID as it was emerging, and then bringing instructors into the conversation helped set us up where, when we were then making decisions about whether to evacuate or not, instructors were a part of the conversation. I think one of the most stressful positions to be in as an instructor is when you feel like you don't have agency, and you feel like decisions are being made, at least for our organization, thousands of miles away, that have a direct impact on you. So bringing them into those conversations early was really helpful. And then we've been just doing like both regional as well as whole group. Zoom's the answer, right? As much as possible to bring them into virtual hangouts and chat to really debrief, because everyone's in a lot of isolation right now. We have instructors that live in Nepal, but that one of them is stuck in the US right now because they can't get back to Nepal. All of our instructors have left the field and are in very isolated situations. So we're really drawing on Dragons as a community to support them. thinking about housing, like where they're living, trying to, think creatively about how to support them where they're living, especially returning from a program where they might need to be, quarantined for 2 weeks. So yeah, really just being honest with our own kind of concerns about it and involving them in the conversations as much as possible. We also have a mental health professional that we offer to staff if they, have work-related stress and trauma. So that's another resource that we do make available.
Yeah, like Tim, I think we're just all kind of drawing on community and having those conversations and video chats as much as possible. Throughout this whole process, we've been kind of overly communicating with our HQ staff and our field staff, being really transparent about our concerns and possibilities for employment and how things look moving forward. And I think just maintaining that openness and level of transparency makes a big difference in trust levels, especially. We've also been able to offer all of our spring overseas educators an additional contract to continue supporting their students with some digital remote learning. So that's been an additional way that we've been able to provide a layer of like employment and financial support and allow them to kind of remain connected to their program directors and our community as a whole.
Here's a question from Julia. If your organizations were set up to run in-country programs this summer, can you think of any creative ways that you might go ahead with that? Would that be possible? Do you see that as something that you could adapt to quickly if you had to? Tough question, Julia.
Yeah, I don't know if I have a very positive answer to it. I expect that this summer will be, some things will change. Like I think some restrictions might loosen up within the US. I think others will remain. Like for example, having a group of 4 in a tent, like a typical outdoor education program where you have 10 students and, maybe 2 or 3 tent groups. That might be unrealistic. I think, traveling around in a van with, 12 students, for a few hours to get to a destination, that also might be, against the guidelines that are still in place in June, July, August. So I think there's certain restrictions with like those kinds of or like intimate community. Even if you're doing domestic programs, like in a community or something like that, like coming into someone else's home, maybe a stranger is probably not going to be, on the table for this summer. I'm in this space right now where I do expect that 2-3 months forward, similar restrictions and similar concerns will be in place. I think China is an example of that. China started strong restrictions in the beginning of January. 3 months later, it's only starting now to loosen up a little bit. And I think there's no reason to expect that it'll move quicker in other countries. So there's that, but maybe, there are ways to manage programming within that. I know organizations are talking about, having students maybe, have medical evaluation, have some pre-screening before coming on program. We're all, most of us are living in pretty strong quarantine right now anyways, that maybe that's like a buffer that can create some sort of structure to bring a group together, for a domestic program in the summer as well. But the things that will be tough, I think, would be like going into communities, engaging with strangers, passing through, small towns, those types of things, I think living in tight quarters. I think those are the kinds of things that'll probably be really difficult even this summer.
Anything different to add from anyone?
Yeah, and I wish just to say, I know there's a lot of people in the attendance that, are more in this question with domestic programs that might be leaving in, 2 months or a month or even sooner. So I think there's probably some rich conversation out there that is maybe different even than the international focus that the 3 of our organizations have.
I did do a webinar maybe 10 days ago now, which seems like forever, given how much we've learned in that amount of time. But it was that different, and I gave all of you a link to a document, which is online, um, which is called COVID-19 Resources, and there's a link in there to the AOR website, the Association for Outdoor Recreation and Education, where that webinar lives. And it does talk a little bit more about operational program decisions, looking forward, things like that. So I would encourage you to take a look at that, as well as, just consider, what is your actual program type? There are, for example, wilderness therapy programs that are considered essential services. They're healthcare, and they are up and running and making adjustments to their policies and procedures and operations to be able to continue to serve their populations. Whereas in other programs, elements like travel restrictions, shelter-in-place orders, the downturn in our economy, things like that are going to be significant challenges for those programs to operate in any kind of normal way for the summer of 2020. So, I think that is, I think one of the overarching things that I would say is to really accurately assess case by case and continue to be flexible and learn as we go, because this is as the theme of today's talk has been uncertainty and rapidly evolving understandings of the situation. So I hope that that's broadly helpful to folks. So we are coming to somewhat of the end of our time, but I want to end on just a few thoughts here. And to keep these discussions going, please stay connected. There's, my company based out of Seattle. We're a risk management consulting company that exclusively works with experiential, outdoor, and wilderness-based programs. And you can follow us on all these different social media sites. I would like to give a huge thanks to the panelists and see if you have any final parting words that you'd like to say to the participants today.
I think for me, first of all, thank you again, Steve, for hosting all of us. This has been truly a wonderful discussion and a learning opportunity. I think I will just second what you just said. Assess your program, and even in the midst of such a fast-moving, evolving situation, be true and consistent to your organization's values and mission. And that's sort of hard to do. It seems like a cliche thing to say, but we got this counsel from Steve at the beginning, and that was extremely helpful to us as we kept coming back to what do we care about, what are we trying to do in this world, and how are decisions affecting our fellows. And I think once you keep the focus on that and being true to yourself, the other thing that Steve told us is that no matter what decision you take, 10% of your stakeholders are not going to be happy with you. We learned that too. And that was good framing for us as we were doing our communications and going on. But really just be true to the values of your organization and your company. And I think when you stick with that and make clear and concise decisions, you will be able to move through this. Will be my little parting nugget of wisdom.
Thank you so much.
Yeah, thanks, Steve, for organizing, and thanks for everyone attending and for all the great questions. My greatest hope moving forward from here is that we can continue having these conversations and collaborating as colleagues in this experiential and outdoor space. These conversations have been really uplifting and supportive for me, and I know other people as well. So I hope we can continue collaborating as we move through these stresses and challenges that are definitely going to come up in the coming months.
Yeah, thank you all. Thanks, Steve, for hosting. I think our greatest concern as an organization is that this pandemic will further isolate, cultures and people, and we do need to find a way to operate creatively in this space to continue building bridges and connections between people, because both are possible as a human response, to a pandemic like this. So I want to work with you all and with our, greater community to keep that alive.
Great comments. I would like to really deeply thank the three panelists who took a lot of time out of their very busy weeks to share their learnings and insights, not just with each other, but with all of us, and deeply appreciated. I also am very grateful for this community that came together on this call. We don't have all the answers. We have an opportunity to create some community and to share our insights with you. And on that note, I'd just like to end on a reminder that we have a chance right now during this very strange pandemic time to adapt and to stay healthy. And a lot of people talk about social distancing. I would disagree. I would say that what we're practicing is physical distancing, and what we're actually doing is socially connecting through calls like this. I've been having evening video, Zoom calls with people all over the country who I somehow fail to find time to connect with in my normal routine, in my normal life. And while COVID-19 has given us a lot of stuff that we don't want, I think it's also giving us an opportunity to adapt and look at what's really important and connect with people. And we do not need to socially distance. We need to socially connect and professionally connect like this while physically distancing to allow us to flatten the curve of contagion. So just wanted to end on that really hopefully positive note. And I am very open to any follow-up comments, questions, feedback, any way that me and my team can support you with your risk management efforts. We'd be very happy to learn what your issues are so we can try to help you. And I will give a big virtual round of applause to our panelists today. And with that, we'll go ahead and wrap up and wish you all the best. Stay socially connected and physically distanced. And as Tim said, we will get through this. So thanks very much, everyone.